was your last bowel movement? What do your bowel movements look like? Because remember, we never accept normal. Um, what, when's the last time you urinated? What color is your urine? Is it clear? Is it cloudy? Does it hurt or burn when you urinate? Do you have any sores in your genital area? Or any discomfort in your genital area? These are my questions to see if they have any sexual dysfunction types of disease processes, with, you know, to STDs or anything like that. Are you sexually active? So do you partner use protection? Do you have any questions that you want to ask me about protection? Okay, that's great, thank you. You always just offer. You have to be just very matter of fact, and people will tell you what they want to know or what they don't want to know, but you want to give them that opportunity, because when you have your lectures on STDs next semester, a lot of times there's not a lot of symptoms. That's why I asked about sores, drainage. There should never be that in the genital area. Something's happening if there is. Okay? All right, I'm just gonna pull the covers down a little bit more because I want to look at your legs. Okay, everything looks good. I don't see any sores. I'm looking at the coloring. I'm checking the temperature to see if any kind of redness, pressing down on both of the lower extremities and really the upper extremities to see if there's any edema. So if there is, you have to indicate how many centimeters. So is it 1 plus? That would be 1 centimeter. 2 plus is 2 centimeters. 3 plus, 3 centimeters. Right? And if one leg is larger than the other, you want to make sure you document that really well. Then I'm going to look at her feet, or his feet, if you got it right. His feet. Ask him to check his strength by pushing up against my hand, pushing down against my hand. I do that on both sides. Check capillary refill. Besides checking a pedal pulse, which is here, I like to also check the dorsal tibialis, the popliteal. There's a pulse. The femoral is in here. You don't have to check that because that is in the genital area, but if you should be able to feel pulses in those other peripheral pulses. Radial, brachial. We already did the carotid, and there's a temporal. So those are all the peripheral pulses, and it's always a good habit to check those as well on both sides of the body. Okay? What did I miss?
Just the range of motion for the legs.
Okay, yeah, so range of motion for the legs. So what I like to do is I like to ask the client, can you bend your knee up? Can you put your knee straight? Can you push your toes down towards the bed? See if they can do this. Can you pull your toes up towards your head? See if they can do, or your feet up towards your head. Can they wiggle their toes? Someone said that in simulation. That's a good way. With the hands, I already did that, but again with the feet, can they move their legs out? Which is what? What is that called?
Abduction.
Right, abduction. Can they move their leg across towards the middle of their body? That's abduction. And then you pretty much have most of the range of motion for the leg, even when they're laying in bed. Now, if they're ambulatory, you can have them do that with you and just mimic what you're doing in the bed, you know, at the bedside, and check it, you know, make sure that they can do hyperextension, because hyperextension, you don't want anyone to fall. And we have people that, you know, they're not in the greatest shape, they don't feel really good, so be careful with the hyperextension. But even in bed, if they can roll on their side and pull their leg back, that's hyperextension. And then, of course, ask all those questions as well. So when you're at home, do you live by yourself? Or do are you able to take care of yourself independently? And if they say yes, ask more questions to see exactly what independently means to them. Do they cook? Do they shop? Do they do their own laundry? Are they able to dress themselves? Can they bathe themselves? I mean, some of those are very basic things that we figure everyone can do independently, but everyone can't. Cause these questions are all, preparing you to call social worker and tell them exactly what assistive devices or, outside help they're gonna need when they're at home, so they don't come back into the hospital because they can't take care of themselves.
See, currently I work with a lot of dementia patients, and I know they'll say yes to